Welcome back, everybody. Welcome to the Cannapreneur Partners Canna News Break. We've been saying this for a while, and it just every time we look up, there's another study coming out, another that just shows the power of this plant when it comes to the opioid crisis. And there's no question we have an opioid crisis in the U.S. Whether you want to call it prescription medicine crisis, an illicit opioids, your fentanyl, heroin, whatever. There is an absolute opioid crisis in this nation. And you could argue globally, but we'll stick with the U.S. for right now. Between June 2019 and May 2020, there were 81,000 overdose deaths, the highest number ever recorded, according to the CDC. Most of those deaths were contributed to synthetic opioids, especially ethanol. So ethanol, cocaine, heroin, methamphetamine, those are your synthetic opioids. Across 10 states reporting relevant data, synthetic opioid-involved deaths have increased by 98% compared to the previous 12 months. And this is due to COVID and the lockdowns, and you take people who have addicts and addiction problems and you lock them alone in an apartment or a house for 12 months, and we shouldn't be surprised that there's negative outcomes that happen to that. So it's a stunning number. We've known the Army has reported that deaths were up last year 20%, suicides were up 20%, but to see these numbers, it's just stunning what's happening out there. But there was a patient study published in December 2020. They surveyed almost 1,200 registered medical cannabis consumers in 21 clinics across Canada to see how cannabis affected their quality of life and prescription opioid use over a 6-month period. At the start of the study, 28% of participants reported having one or more active opioid prescriptions. After 6 months, that percentage dropped to 11%. Of those still managing pain with prescription opioids, doses dropped from 152 milligrams of morphine equivalent per dose to 32, a 78% reduction in the average opioid doses among the group. So think about it. The percentage of people taking opioids dropped by almost 65%, and of those people still taking them, they dropped by nearly 80% the amount of the opioid they were using. What's the one difference? They were using medical cannabis. They're using a plant to help them monitor their pain, monitor their conditions that are causing them to take these opioids, which are all highly addictive and highly lethal and highly dangerous. We all know this. So, again, this is another study. And you could pick your study. Pick your opioid addiction, pick your study, and there are study after studies after studies that show cannabis reduces people's dependency on dangerous and lethal opioids, both legal opioids that your doctor gives you and the illegal ones you can buy in the illicit market. Cannabis helps people with opioids. It helps them get off them, and those who stay on it, they reduce their doses by 80% in this particular study. So, again, this plant is doing so much for society and so much for people. It's nice to see our government slowly starting to get on the wagon here, but I'm of the opinion that the single most important thing we could do to help manage the opioid crisis in the U.S. is to legalize this plant on a federal level and give it access to people who have these problems, because study after study shows it helps them get off or use dramatically less of their opioids. So let's hope it sees us soon. We're going to see more studies just in the coming weeks, and every time we see one, we'll bring it to you, because if nothing else, politicians need to hear that this plant, it's a plant, helps people get off opioids. Thanks, and have a great day.